Hi Danielle.
Hi Gowri.
You had a baby just 12 days ago.
Yeah, 23rd of November.
Congratulations.
Thank you.
And you have already been wrapping
Yeah.
with the cloth and the closure garment.
Yeah.
That's wonderful. Would you mind if we demonstrate on you how
Cool.
it's done? Perfect. So Debbie's here with me, and we're going to ask you to just hold the beginning bit of the wrap. And as you can see, there's 6 meters of cloth which we folded over, and we're going to really bring the rib cage together. And for this, we tie the sari quite tightly around the rib cage, because it's crucial that we get the rib cage well secured, because during pregnancy the rib cage does flare out, and this is an age-old, time-honored tradition of bringing the rib cage together. And then once we have secured a nice band of tight material around the rib cage, we move the material a little bit lower down so that we also offer some support to the abdominal organs, the liver, the intestines, and to the pelvic zones. As you can see, Danielle is looking pretty good already, and I suppose she will share with you a little bit about how she was very careful with her eating plan during the pregnancy, so that her intestines are beautifully relaxed, very calm, and are able to go back to their pre-pregnant shape, size, tone very, very quickly, immediately after the birth. So the reason why we use loads and loads of cloth, strong cotton cloth, is because we do not want to have elastic around the body, because there's too much give in the elastic. And once we've done that, we just take 2 simple safety pins and we just secure the loose end, just for the sake of securing it, one at the top and one at the bottom.
Well, it's really thick, Brennan.
Just here.
Can't quite get it in.
And then we secure the cloth so that it doesn't go rolling around and riding up, with a beautiful wrap which is designed by Bo of Bo Peeps.
Right, ready. Let's go. So it's quite easy just to bring the garment in, so as the mother gets gradually more slender, as the pre-pregnant weight just drops off, the garment can be made snugger.
As you can see, there are 3 rows of clips of hooks and eyes. So the first layer is where we are at right now, and in a couple of weeks Danielle will probably be wrapping to the second level, bringing it in as much as she can. Of course, as we become, already it's quite loose at the top. As you can see, in another couple of weeks she'll be down, tightening up there. You can see the lower. Most importantly, Danielle, how does it feel to have all this tight wrap?
It's very comfortable. My back and posture feel a lot better once it's on. Just a lot. It feels like a lot of support, and everything seems fine.
Especially because of the back. Because during pregnancy, there's a lot of pregnancy hormones, which gives a lot of laxity to the ligaments of the back. And once you give birth, you need that support to be standing straight, to be able to sit up straight when you're breastfeeding. So this actually helps with breastfeeding, with keeping your back straight. Because they always say, bring the baby up to you. You do not go down to the baby. So bringing the baby up to you, this helps you to sit straight in a proper position for breastfeeding.
Yeah. So when I first came to the gentle birthing method, I saw Kasha, just for a bit of reflexology. This was before I knew anything about, you know, the diet, nutrition or anything. I just wanted a nice massage to relax with. And then she recommended that I try the hypnosis and come to the classes, which I really enjoyed, and that's how I met Debbie. So when I think about the team, all I can think about is how can I thank all of them enough. You know, they've really given me the best experience of pregnancy. You know, I've seen friends and family who've suffered and who are scared, and that's how I was at the beginning. And from how I was at the beginning to how I was right at the end, you know, it's I can't believe how I coped. You know, when my waters broke, for me it would always be a time where I'd be screaming, crying, oh my gosh, what's going to happen? But I was so excited, and I packed my bags, and you know, we were going to the hospital, and you know, I was looking forward to I was looking forward to meeting my baby, and I was looking forward to seeing how my body would cope with giving birth, which it did very well, but thanks to all of the gentle birth method team.
That's wonderful. And we were so happy you came to so many of the self-hypnosis
I
classes.
did.
And you also were able to experience the micro movements as well. So that's
which I used during labour, which are really helpful during contractions, with my breathing and on all fours, and yeah, the micro movements really helped.
Excellent. So you were really able to have a very active birthing process.
Yeah, definitely. I didn't want to just sit on a bed and give birth. I was on all fours, and you know, at times people looked at me like, what are you doing? But I didn't care. I knew this was the right thing for me and my body, and that's what I did.
Excellent. So you allowed inhibitions just to fall away.
I mean, yeah, definitely. I mean, there is an intelligence behind the method and the team, and that's what I believed in, and that's how I gave birth to my beautiful baby boy.
And what's his name?
Jacob.
Lovely.
Jacob.
Oh, we're all delighted
Thank
that
you.
you have Jacob with you now.
If there is one piece of advice you'd like to give pregnant mothers out there, what would it be?
It would be, I've thought about this a lot, and it would be preparation. Don't just go into pregnancy thinking it's a time to indulge and do whatever you want. It's not. You have to prepare your body, you have to nourish it, you have to relax, you have to, you know, really just look after yourself. You know, don't rush around, you know, you need your body to prepare. You're going into labour. It is a labour, you know, you have to be prepared mentally and physically, and
appropriate preparation.
Appropriate preparation, yeah.